So I'm not gonna lie, when I got this picture, my heart sank. Mira was on a spring break trip with some of her friends. They're very well supervised. It was an absolute freak accident. She got hit in the face with a roasted marshmallow that was actually still on fire, and it created significant burns. And so with her permission, I'm going to use her story as a teaching case on how to treat burns like this. For those of you who don't know, I'm a Harvard and Yale trained board certified facial plastic surgeon with about 20 years of experience. I create facial burns on a daily basis through chemicals and lasers. And so I'm very well qualified to treat burns like this. All that being said, I am not your facial plastic surgeon with 20 years of experience unless you're actually my patient. So if you sustain a burn like this cannot substitute for medical advice. You need to go talk to an actual doctor in person and get guided on a daily basis. But with that being said, what is a burn? A burn is an injury to the skin. It could be caused by heat, as in this case. It could be caused by friction, by cold, by chemical, by radiation, by solar radiation, like a sunburn. In any of these cases, what's happening is the skin is being injured and killed, really, from the outside in. And so we're gonna focus on heat burns, because this was a heat burn. And the first layer to get killed by heat, it's actually being cooked, is the epidermis. Literally says on top of the dermis, the epidermis. The epidermis serves as a barrier. It's a barrier for evaporative losses, and it's a barrier for infection. So once the epidermis is burned, you have to think about evaporative losses and infection. So if only the epidermis is burned, that's what we call a first-degree burn. And the symptoms are usually pain and redness, because the little capillaries that make you blush, they open up widely in the dermis to help shed excess heat and bring in healing materials and take out waste products. And so red, scaldy kind of pain and stinginess, that's the symptom of a first-degree burn. Second-degree burns imply that the burn went all the way through the epidermis and has now injured at least the superficial part of the real body of the living skin, the dermis. And in this case, it's very common for the epidermis to separate from the dermis and create a blister fluid, a blister sac between the two. So if you're seeing blisters, you've got a definite second-degree burn. These burns are also typically painful because the nerve endings in the dermis live in the deep dermis, so they are still alive and it still hurts. They also turn red, same reasons. The blood vessels are trying to shed excess heat and they're trying to bring in healing materials, take out waste products. Third-degree burns, even deeper. So a third-degree burn has burned all the way down through the bottom of the dermis, including the nerve endings. And these burns look and act very differently. They typically don't hurt. They're too deep to hurt because they have burned away the nerve endings. And they're typically not red, because just like red meat, once you cook it, it becomes brown. Kind of same things going on here. They typically look more brown or black or gray because there are no viable capillaries in there. So once you've hit a third-degree burn, chances go up dramatically that you're going to need skin grafting or burn surgery or that kind of thing. First and second-degree burns, where there's a fair amount of dermis remaining to heal, we can usually get it to heal on its own. So when we have a heat burn like Mira has, the first thing we're trying to do is to prevent ongoing injury, trying to limit the injury. And the first thing I had her do, as you can see here, is take ice cold washcloths. So we have a salad bowl full of ice and just tap water, and she's cycling these washcloths through there and holding them on her face. And I was guiding her through this just by text message and FaceTime. And so she keeps cycling ice cold washcloths on her face to pull out all of the excess heat and to keep that burn from propagating deeper and deeper. This phase usually hour or two, something like that. At that point, now we turn our attention to preventing injury for other reasons. We don't want that open skin with barrier function that's been compromised to get infected. We don't want it to dehydrate because the evaporative barrier is missing. So what we do is we replace the evaporative barrier with a bland ointment. And in her case, all she had access to was Aquaphor. You can get that at any drugstore, so that was perfect. I typically prefer Vanaply if I'm doing a laser burn or a chemical burn. I think it's a little less sensitizing. Honestly, Crisco works. Any Vaseline works. Anything with no antibiotic in it, because the antibiotics, those are chemicals meant to get in the way of dividing cells, dividing bacteria. and they can also decrease the division and healing of skin. So unless it's obviously infected, I typically prefer a non-antibiotic ointment. Second thing that we have her do is, you could consider doing, is using an antibiotic orally or a topical antibiotic. And in very small burns of the face like this, typically they don't get infected with bacteria, and they typically don't get infected with viruses. So I actually did not have her use any kind of oral antibiotic or topical antibiotic. It was solely bland ointment. If it was a larger surface, I might consider a oral antibiotic, something in the penicillin family, or even an antiviral like valacyclovir if I was really worried about cold sore formation. But something small like this, I didn't put her on any of those. This phase, ointment, ointment, ointment. We never want to let it get dry. This phase goes on for about a week. And so there's no special washing attention. We always keep it greasy with ointment, ointment, ointment. Those blisters will eventually pop and separate. It's incredibly difficult, as you can see from this message, not to pick those blisters off. You want to so hard, but we let the fluid leak out and we let the blister surface stay on there. That surface is what we call a biological dressing. It's helping to prevent infection. And so if you start picking it up and taking it off, you're actually mechanically worsening that injury. So let the blister surface stay right on there. After about a week of this, just keeping it greasy, keeping it greasy, keeping it greasy. We let her shower, we let her wash her face as per usual, but greasy, greasy, greasy. Kept it out of the sun, kept it protected with big broad-brimmed hat. She was at Florida. After about a week or so, you can see that the blister surface is gone, and she's starting to evidence brand new skin underneath. But the epidermis, the layer that's burned and gone, that's the pigment layer. And so you can see her pigment is not totally normal. So now our attention turns to trying to manage the healing process to maximize the chance that pigment heals normally and to try to minimize the chance of thickening scars. Because you can see right here in the glabella, right in that middle section, she was more than just a superficial second-degree burn. She was into a deeper second-degree burn. So we want to manage the chance of that area being thick. So at this phase, I switched her to two products that we carry. I switched her to a calming cream, which is a aloe and hydrocortisone based cream. That hydrocortisone helps minimize the chance of thickening scars. It also helps in pigmented skin, helps minimize hyper or hypopigmentation. So it's a very mild hydrocortisone and an aloe base. I think it's perfect. I had her start using this around the 5th or 6th day. The other thing I had her start using is when her skin is completely healed, around 7-8 days, I had her start using a pigment evening product. And that, again, we carry, those are called Koji pads, K-O-J-I. So the Koji pads help minimize post-inflammatory hyperpigmentation. So again, the first 5 or 6 days, it was nothing but bland ointment, sun avoidance. Starting right around day 5, 6, 7, we switched into the hydrocortisone mild aloe cream, which we call calming cream, supplemented with the Koji pads. The Koji pads are twice a day and the calming cream's a few times a day, and then sunscreen on top. So day 5, 6, 7, right in there, Koji pads twice a day, calming cream a few times a day, sunscreen on top, broad brimmed hat, sunglasses. Remember, she's in Florida. And we just kept that phase going, the calming cream, Koji pad, sunscreen phase going for a month, month and a half. And what you can see now is how she healed. And I think she healed beautifully. We got very lucky. The superficial areas where it was second degree on the shallow side healed great. Even the deeper area, which was kind of deeper second degree burn, it's healed really well. And the pigment is nice and even. There's no thickening. So I think we got very lucky. She was a trooper. She did exactly as she was asked every step of the way. And so her cooperation is part of what made this do really well. At what point do we let people put on makeup? Usually when the skin's intact, 7-8 days, something like that. When we've switched to that phase with the calming cream and Koji pads, that's usually also the makeup and sunscreen phase. So again, I can't take the responsibility of being your doctor entirely for these kinds of things. You really do, especially in a high stakes area like this. You need to be in contact with an actual facial plastic surgeon that is caring for you specifically and directly and watching you every step of the way. but I did want to share candidly with you when this struck my family, what we did to navigate the healing process and get the best possible outcome. So I hope you found that was helpful. If you did, please leave a comment below, save this, share it with a friend. Someone's going to need it later. And as always, let me know what else you'd like to learn. Thanks a lot.